The purpose of a lung scintigraphy is to evaluate patients for possible pulmonary embolisms by utilizing radioactive pharmaceuticals to acquire images of the lungs. Other indications for lung scintigraphy include evaluating pulmonary function for surgeries related to lung diseases such as lung cancer or lung transplantation. Lung scintigraphy can also be utilized to evaluate some cardiac conditions. There are two types of lung scintigraphy: lung ventilation and lung perfusion. These studies are performed by a certified nuclear medicine technologist. A lung ventilation study is utilized to show the bronchopulmonary distribution of air within the lungs. A gas or aerosol radioactive pharmaceutical is inhaled by the patient and imaging is acquired while the gas or aerosol distributes throughout the lungs. A bolus of xenon-133 is inhaled via a ventilation system, 5 to 20 millicuries. A lung perfusion study is used to image arterial blood flow in the lungs. A radioactive material is intravenously injected in the patient. It combines with blood in the heart and is distributed via the pulmonary artery into the lungs.
Using a source, position the patient in front of the scintillation camera. Ensure both lungs are within the crystal area. Set the camera for xenon-133. Be prepared to record all data after xenon injection. Turn the power switch, located on the patient side of the unit, to on. Place the Pulmonex 2 as close to the patient as possible and set the handle to the start position number 1. Set patient airflow control to 30. Set trap airflow control to 0. Press the button on the front panel to add oxygen to the patient bag. Only add a small amount of oxygen, about 1/4 full. The bag will only move slightly. Do not fill it up. More oxygen can be added later if it is required for the patient. In many cases, it is possible not to add any oxygen and perform the entire study on ambient air. In all cases, the oxygen is only to enrich the air in the circuit. Make sure the system is in the start position number 1. Set the timer to 9 minutes. Remove the face mask or mouthpiece from the tubing. Place the face mask over the patient's face and attach mask retainer or mouthpiece and nose clip. Have the patient breathe to get accustomed to the face mask. With the handle in the start position, connect the mask to the hose. Instruct patient to breathe briefly while becoming accustomed to the face mask and tubing. The front patient bag will move slightly as the patient exhales. Switch the handle to single breath equilibrium position number 2. Use either an injector gun or a syringe filled with xenon and puncture the injection site of the face mask, mouthpiece, or direct dose adapter. Add xenon as the patient takes a deep breath. Instruct patient to hold breath for as long as possible. After exhaling, the patient should resume normal breathing while you increase the patient airflow control to 40. Advise the patient to breathe normally. Observe breathing bags moving through the front panel windows. Add oxygen if necessary for patient comfort. Once the patient reaches equilibrium, 1 to 2 minutes, the counting rate on the camera stabilizes. Switch to washout, position number 3. Turn the trap airflow control to 50, about 10 seconds before going to washout. Take washout data on the camera. Have the patient breathe normally. Carefully watch the front patient bag. If it starts blowing up, the patient is breathing too fast. Advise normalized breathing and increase the patient airflow speed. If the bag continues to expand up towards the glass, the patient will feel back pressure and resistance. To relieve this effect, increase trap airflow by turning the trap flow knob clockwise until the breathing bag deflates. Return the control to approximately 1/2 of its range when the study is complete. The use of this trap motor control will be a rare occurrence. Do not adjust unless absolutely necessary and be sure to return it to its original position. To be effective, the increase in motor speed must be accomplished before the bag is full. Thus, it is vital to watch the front patient bag carefully during washout. When the washout is complete, remove the patient from the system. Allow the system to run for a few more seconds or until both bags are empty.